The American healthcare system is flawed, it doesn't work, and the people are frustrated. Last week, this rare admission came from the largest American healthcare firm, the UnitedHealth Group. The conglomerate CEO, Andrew Witty, penned an op-ed for the New York Times over the killing of one of the firm's top executives, Brian Thompson. He admitted problems like lower coverage and high costs of insurance and drugs. Earlier this month, a 26-year-old allegedly gunned down the chief of UnitedHealth's insurance business. While the actual intention behind the murder is still unknown, speculation on social media has given it a certain direction. Users pointed to the writings found on the bullet casing at the shooting scene. It had the words "delay, deny, defend" carved on it. Netizens linked it to a book of the same title by J.M. Feynman, which explores how Americans have been suffering at the hands of insurance companies. UnitedHealth, being the healthcare services provider for nearly 8.1 million Americans, has on social media become a symbol of this injustice. So, as the probe and debate over the killing of the top American healthcare executive continues, let's try to break down what's wrong with the healthcare system and how it got here. Americans spend more on healthcare than any other developed nation. According to a recent report by the Peterson KFF Healthcare Tracker, an average American spends $12,555 annually on healthcare, whereas people in other developed nations pay just about $6,651 per year. Additionally, despite several government-sponsored insurance coverages, millions of Americans remain uninsured or underinsured. According to the U.S. Census Bureau, 26.4 million Americans had no health insurance in 2023. Just as many struggle to afford coverage options, or they complain that their insurers are putting up roadblocks. A KFF healthcare report also found that about half of American adults say it's difficult to afford healthcare costs. And 1 in 4 say that they or a family member in their household had problems paying for healthcare. The cost of prescription drugs is also preventing people from filling prescriptions. About 1 in 5 American adults say they've not filled a prescription because of the cost. Those covered by health insurance are not immune to paying out of pocket. About half of insured American adults worry about affording their monthly health insurance premiums, and the report also found that 41% of American adults have debt due to medical or dental bills. It could be owed to anyone from credit cards, family and friends, banks, and other lenders. But when it comes to taking responsibility for this system, the blame is passed around like a football among hospitals, drug makers, insurance firms, and the government. Hospitals blame drug companies for high prices and insurers for restricting benefits and leaving patients with uncovered bills. Drug companies say the issue is with insurers, as they impose high out-of-pocket medication costs on patients. They also criticize pharmacy benefit managers, or PBMs, for driving up costs. Pharmacy benefit managers are third-party companies that manage prescription drug benefits for health insurers, employers, and other payers. They act as intermediaries between insurers and pharmaceutical manufacturers. They negotiate rebates, process claims, build pharmacy networks, review drug use, and manage mail-order specialty pharmacies. Major PBMs include CVS Caremark, Cigna Express Scripts, UnitedHealth Group's Optum Rx, and Humana Pharmacy Solutions. PBMs were originally established to help insurers control the soaring cost of prescription drugs. However, they are accused of allegedly inflating the cost of prescription drugs by retaining manufacturer rebates instead of passing them to insurers.
So maybe I'll start. First of all, I just think it's a very sad and heavy moment. It was a tragedy of epic proportions, and you think about the families affected, and I think we're just still reeling and trying to get a handle on actually what happened. In terms of the comments online, I will only say that I think all of us are taking a step back and trying to understand what's happening with patients and their experiences. We always do that at Pfizer. I know you do that at Amazon. But clearly, there's a larger dialogue that needs to happen, and we're going to be taking our time to try to understand exactly what happened and understand that feedback and see where we can play a positive role. Then,
yeah, no, exactly. I mean, I couldn't agree more. I mean, I'll say as a clinician that two things can be true. One is our health system needs to be better. I think we all agree on that, and there's a lot of things that for decades, this is not new to the events of last week, which horrifically tragic. There's a lot of things that should cause a lot of outrage by many of us. That's why we're building what we're building at Amazon, because we think that we can be part of a better solution. So there's a lot of inspiration and frankly motivation out there to have a better system in place, and I think we're seeing the signs of that. It's also true that that should not have happened, and so there cannot be this false moral equivalence in our public discourse.
In his op-ed for the New York Times, UnitedHealth CEO Andrew Witty said that the American healthcare system is the result of years of patchwork. When we see the government's contribution to its healthcare system, it becomes very evident. Between free market-loving Republicans and regulation-advocating Democrats, there has been a lot of back and forth in terms of insurance, drug cost control, and other benefits. The 2010 Affordable Care Act, or what's known as Obamacare, has been a landmark change in this regard. Before Obamacare, the US healthcare system was primarily employer-based. Insurers were often accused of denying insurance coverage to people with pre-existing conditions or charging exorbitant premiums. While some states provided a program called Medicaid, it was available only to specific low-income groups such as pregnant women and children. Obamacare aimed to expand healthcare access and reduce costs. It expanded the federal insurance scheme called Medicare that covered those above 65 years of age. It also helped state governments expand coverage under their Medicaid programs. The law mandated insurance companies to include essential health benefits like maternity care and mental health services in their plans, while prohibiting insurers from denying coverage due to pre-existing conditions. Further, to help others, it introduced marketplaces for individuals to purchase insurance, often with subsidies for low-income earners. However, it also received backlash for mandating most Americans to have insurance or face penalties. Under President Donald Trump, this provision was repealed in 2019. He also allowed some states to bypass certain Obamacare provisions, allowing insurance plans with fewer benefits. Under the Biden administration, the focus has been to reduce the cost of certain drugs under Medicare and enhance subsidies for coverage. Although the COVID-19 pandemic halted this progress, post-pandemic inflation drove the overall cost of living, including medical and healthcare costs, further exaggerating issues for vulnerable people. As things stand today, approximately 92% of Americans have health insurance. Employer-sponsored insurance remains the most common, covering over half of insured individuals. Government programs play a significant role, with Medicare covering around 18.9% of the population and Medicaid insuring about 17.9%. Additionally, many people purchase insurance directly, most often through Affordable Care Act marketplaces. Despite high coverage rates, disparities persist, with uninsured rates higher among young adults, Hispanic populations, and people in specific geographic areas. Insurance premiums and out-of-pocket costs are still hurting millions. The murder of Brian Thompson has reopened a critical conversation about America's healthcare system. UnitedHealth CEO said it himself. No one would design a system like this, and yet millions of Americans remain trapped in it. The question is, who will fix it?
Hello and welcome to this special edition of Vantage, live from the White House.
Like nobody's ever seen before.
The night progress numbers came in thick and fast, and it says, President Trump save America. But this hat is made in China. Live from the White House, soon to be the new residence of Donald Trump. From the outskirts of Washington, D.C.
He did a great job. He was very fearless.
you all very much. This is great.